The Chronic Pain Coalition presents the use of low-dose naltrexone and Normast in the painful bladder syndrome.
Hi, I'm Dr. Keppel Hesselink and I'm a specialist in the treatment of chronic pain. In our clinic we very often see patients suffering from chronic pain. Among those patients there are patients with interstitial cystitis or the painful bladder syndrome. In the painful bladder syndrome there is one cell, it's called the mastcell, and here's a model of such a cell which has been gone berserk. It produces a lot of irritating and pain-inducing compounds. We very often get questions whether this problem of the mast cell can be treated with a body-owned compound called palmitoylethanolamide, and whether it can also be treated with low-dose naltrexone. Well, in our clinic we prescribe Normast, which is a brand name for palmitoylethanolamide, and a compounded capsule containing 2.5 mg of naltrexone, a very low dose naltrexone. Normally you give patients which are in alcohol abstinence 50 mg of naltrexone, and we give 1/20 of that dose. Can you combine palmitoylethanolamide, which stabilizes the mast cell, and low-dose naltrexone, which helps the body to respond to pain in a better way, basically, which is a very friendly analgesic? Can you combine these two without problems? Yes, you can combine these two without problems. They both have a very interesting mechanism of action. The palmitoylethanolamide, it inhibits pain and it reduces inflammation, and the naltrexone makes the body more susceptible for our own body-owned analgesic compounds of the so-called endo-opioid system. And furthermore, it also has a calming effect on certain cells around the nerve cells called the glia cells. So the mechanism of action of naltrexone in a low dose and palmitoylethanolamide is synergistic, and we very often see patients using this, and via the internet we very often get the question, can it be given together? Yes, it can. No interaction has been described. We have not seen any interactions in our clinic, so it's no problem to combine these two compounds.
Presented to you by the Coalition for Chronic Pain by Dr. Keppel Hesselink.